Well, doctors are warning about a triple threat in the new year.
We're talking COVID, the flu, and RSV spreading simultaneously. Some people are even getting hit with double infections, battling two viruses at the same time. That sounds so miserable. Let's bring in infectious disease expert Dr. Ostrowski with UT Health Houston and Memorial Hermann to talk more about it. Welcome to Houston's Morning Show.
Hi there.
What do you feel is the biggest threat to our area right now?
Well, we are seeing significant numbers of cases of flu, RSV, and COVID. So I'm guessing all of your viewers know somebody who's sick right now if they're not sick themselves. So we're definitely having a lot of viral activity.
And you are absolutely right. I know multiple people sick right now. It's possible to get COVID and flu at the same time, we've heard, doctor, and the symptoms are similar, but the treatment is different. So is it important to go get tested when you do start to feel sick so you know what you're dealing with?
Absolutely. So this is not the time to say it's just a cold. There's 3 going on, and we have treatments for at least 2 of them, RSV also for babies. So it's really important to get tested because that will access the right treatment for you.
What happens, let's say that someone does get diagnosed with flu and COVID, again, opposite, completely different treatments. Are you able to take both medications at the same time?
Yes, it's not very common to have both at the same time, but we have seen that, and we do treat both of them when they're together.
And when it comes to RSV, as we switch to that now, are you seeing it in more infants, the elderly? How is that playing out this season?
So RSV fortunately started to go down at this point. We did see a peak earlier in December, but RSV is very dangerous for preemie babies, infants, and people over 60. And as of right now, we only have monoclonal antibodies for the babies. So again, if your baby's sick, you do need to take them to the pediatrician, get them tested, because they have a treatment available for them.
Let's talk about how long it takes for full protection of that RSV vaccine, and also who's eligible to get it.
So the RSV vaccine is new this year, and we find it very, very useful. It does protect people over 60 and pregnant women in the late stage of pregnancy. They can get it, and it protects them and their babies when they're born. So as of right now, we're recommending vaccination for people over 60 and late stage pregnancy. And very important, it's 2 different vaccines, so you need to make sure that your pharmacy is giving you the right one.
And what about the flu vaccine, doctor? It's not too late to get that, we usually hear you say, but when would it start to take effect? Is it going to really protect us now?
Yeah, so we always say it's never too late. It does take about 2 weeks to fully kick in, but any vaccine is a good vaccine. And especially with the activity that we're seeing in the community right now, it's not too late. So if you haven't gotten this year's flu vaccine or COVID update, go ahead and do it. Now's the right time.
All right. Well, thank you again for taking time from UT Health Houston and Memorial Hermann to help us out today. Dr. Ostrowski, always great to see you.
My pleasure.